The Road to Autonomy, Autonomy Economy Edition. I'm your host, Grayson Brulte. On today's episode, we're absolutely honored to welcome a dear friend, Dr. Peter Weiss, board-certified physician and healthcare entrepreneur who has advised several presidential campaigns and numerous public and private healthcare companies. Dr. Weiss, welcome to the first edition of The Road to Autonomy, Autonomy Economy Edition.
Thank you. I'm excited to be here.
It's great to have you here, Dr. Weiss. We have these incredible conversations over the years about healthcare, economics, and autonomy. We're going to dive into that today. To kick things off, Dr. Weiss, over time, how do you see autonomous vehicles and the delivery of healthcare complementing each other?
It's an exciting time. Artificial intelligence, AI, and autonomy really have become what I call interactive. And healthcare is more than just seeing the physician or a healthcare provider. It's about getting from point A to point B to provide that care. So what happens now with autonomous deliveries, it could be as simple as an elder person needing to get from their home or condo to the doctor's office. You would be able to interact with the artificial intelligence within the car, the autonomous vehicle, as it takes you to the medical appointment.
Well, that's neat. Okay, so let's just say medical appointment's great. That's your world. My world is let's go have an experience and let's go for a ride. So let's hypothetically say that there's a passenger or passengers riding in an autonomous vehicle. When do we get to the point where the autonomous vehicle can know if that person's having a heart attack or if they're in need of urgent medical services?
Now you're really getting interesting. So what happens with most people while they're driving, if they're having a heart attack, you have a heart attack, lose consciousness, and either just crash on your own or hit somebody else, which we know of the number of deaths a year from motor vehicle accidents. It could be as simple as being able to determine that the driver is in atrial fibrillation, which can lead to cardiac arrest. It could be as simple as having a hypertensive crisis where you're able in the autonomous vehicle with the medical AI components, able to say that you're having a hypertensive crisis. So all of these things you are able to determine, and then the intelligence within the autonomous vehicle would determine whether or not it needs to stop the car or to call ahead to an emergency room to get a provider on the line or actually drive you directly to the nearest hospital.
I'm going to put on the delicate hat. I'm not a lawyer, for the record, as the listeners know. I'm not a lawyer, and this is not legal advice. But who makes the call to determine if a passenger is indeed in need of medical care? That's a big decision that somebody is going to have to make.
You're already going into a territory that really has to be analyzed closely. You're right. The lawyers, I'm afraid, rule, and that is very much so in healthcare. So it could be as simple as the ability to predetermine that somebody is going to be unable to handle a motor vehicle, that it would be able to, one, the autonomous driving takes over, as it already is, but then would be able to determine that there's a greater probability of if nothing is done, that the person could die. It could be as simple as the autonomous vehicle asking the patient, how are you feeling? And recognizing that there's a problem and asking the passenger, I've determined that you are at a higher risk for a heart attack. I'm going to transport you to the nearest hospital. And if the passenger now says, no, I don't want to go, that might be enough, because you can't lead a horse to water and make him drink. So all you can do is offer it. If the passenger is unable to respond to the question, then the car should be able to then directly take the passenger to the hospital, and at the same time notify the hospital that we have a patient coming in with a certain blood pressure, certain atrial fib rate, all this information that could really save a life. And especially if you're having, let's say, a stroke, where it's really, within the first 30 minutes, it's critical to get to the facility to help prevent permanent damage. So there's ways to get around it, but I'm sure the lawyers would get involved.
We're never going to have tort reform, for at least in my lifetime or for a long time. And lawyers love technicalities. And one of the technicalities around liability, who's liable for the decision? Will it go to the autonomous vehicle company? Will it go to the passenger? Where do you see that shaking out?
Again, I'm not a lawyer either, but they're going to have a lot of fun with this. I think for the most part, it's going to come from government legislation. As much as I like to see the government stay out of certain directions in what we do as individual and individual rights, I think this is where you can easily come in and have rules and laws that when the AI follows it, they're protected, such as if I think you're having a heart attack and I ask you as a passenger, and it's recorded, and the passenger says, no, I'm fine, I refuse to go, then it's on the passenger. If the passenger doesn't respond, then the vehicle will then automatically take you to the nearest hospital. And I think that's probably going to be the simplest way to avoid it. The lawyers can't stand in the way of progress. That's the one good thing.
No, they can't. Nearest hospitals. So that opens up another can of worms. Yeah, public hospitals, private hospitals, one takes one insurance, doesn't take the other insurance. So in a hypothetical scenario, there's an individual that has say a heart attack or some sort of cardiac. It's in the autonomous vehicles rerouted to a hospital. How should the decision be made into what hospital to take the passenger to? Do they have to know ahead of time what insurance they have or where their doctor is admitted to practice?
Well, here comes the interesting thing. Everyone thinks that you need to have health insurance to receive emergency medical care. The way the law is now, that if anyone walks into an emergency room, even if they have no insurance or they're an undocumented alien coming in, we as physicians and healthcare providers will do the best we can to save your life. So that's the first thing. So it's not going to be about the cost. It's about really saving the life. So the way it works now, if you call 911 or paramedics come, they will take you to the nearest hospital by law. They cannot take you to one that's 4 or 5 miles further that you want to go to. So there is some rules that need to be followed, but for the most part, it works. The system's not perfect, but the goal is, to do the best you can.
What's the implications from an insurance perspective? Let's say that the patient A or rider A goes to a hospital, but doesn't take their insurance. Now they're out of network. I don't know the technical term. You do. They get saddled with a big bill in hospital expenditures. Let's give some economics here, because this is the Road to Autonomy Economy edition. Let's give some economics here. In 2022, hospital expenditures grew 2.2% to $1.35 trillion in the United States, according to the U.S. Centers for Medicare and Medicaid Services. We've got a problem here. Who's going to pay for this?
Now you're really getting onto a really deep topic, and I think we're going to go into it a little bit more. But overall, the healthcare in the United States is around 17 to 18% of the GDP. So it's a tremendous amount of money that's being spent. And by the way, it's not on physicians' costs. It's on the high technology and high costs of healthcare. So what happens is we have an increase in the expenditures on healthcare. A lot of that has to do with innovation and access. So as these newer technologies come out, they're very expensive. We have a lot of issues with costs of drugs. I have a particular beef where you're able to do direct-to-consumer marketing for controlled or physician-prescribed medications. So it entices patients to say, oh, I like that commercial on arthritis. I want drug A, when they're currently on drug C, which is half the price and works very well. So there's a lot of problems in our system, but the costs truly do go up, and it's going to be a complex answer.
Could autonomous vehicles potentially impact these expenditures either up or down?
Absolutely. I actually do believe in autonomous vehicles and AI being more of a solution than a problem. There's always concerns with transition. Everyone is uncomfortable when there's transition, but sometimes transition is needed to make an advancement. So you could take a look at autonomous vehicles. You can have autonomous ambulances or medics. When a vehicle is brought to you and the person's ambulatory, you're able to go into that vehicle and it's able to communicate with you as it's taking you to the hospital, whether it's an atrial fib, like I said, or a heart attack. You could also have an attendant with the autonomous medic. So they might not be a fully trained medic, but they're able to help you get into the vehicle as well. So an attendant. There's many ways that you can provide that service. So it's just going to be an upgraded version, not just the transportation from point A to point B from your home to the hospital, but to be able to provide care along the way.
You open the interesting point around, it's called in-vehicle healthcare. When we get to a point where there's in-vehicle healthcare in autonomous vehicles, what will the economic impact be on the delivery of healthcare? Will it have a positive impact? Will it be more efficient? Or are we going to see a cost increase?
I think there's going to be a cost saving, but everything in life as you begin, there is an inherent initial spike in costs. I think we all remember when we went from the big boxy TVs to the flat screen. They were outrageously expensive, and I wanted one. But we had to wait until the cost came down. And now they're less than a couple going out to dinner. You can get a flat screen TV. So I think initially there's going to be some cost that anything is a spike. But as it becomes more mainstream, it'll be a direct saving to consumer and to the country as a whole. As we talked about, the tremendous cost of healthcare as a general expenditure for our GDP is just something that can't be sustained.
It can't be sustained. It's funny you mentioned the flat screen TVs. I remember the old commercials where Philips, they were on the beach and it was the coolest thing in the world. It was what, 15,000 or 20,000. And that was when the, not Super Nintendo, it was, it was one of the Nintendos that came out and all these new games and every kid had to have it and had to play it.
Well, you had a Nintendo. I came from the days of the Etch-a-Sketch, so...
Etch-a-Sketch was cool and it made a comeback in the Toy Story movie. So everything that's old becomes new again, as we know. But as things become old and new, some things we like, some things we don't like. In 2022, U.S. consumers spent 8% of their income, I repeat, 8% of their income on healthcare. That's astronomical. Let's put that into further perspective here. Because those same consumers here next year spend 12.8% on food. And now we've got higher inflation, so maybe perhaps now it's 14 or 15%, and we get the numbers as we go. This is all data according to the U.S. Bureau of Labor Statistics. What happens over time as the cost of healthcare continues to rise? So let's say in 2022, U.S. consumers spend 8% of their income, and now let's say in 26, now they're spending 13%, 14%. They're spending more on healthcare than food. We're going to get to a tipping point there. Something's going to happen. What happens?
Well, you're really bringing more of a societal question as to how we deliver our healthcare, and it becomes very difficult. This is not sustainable. The sad truth is, in a perfect world, in a utopian world, we might be able to, but this is not sustainable. When I started medical school, I graduated from the University of Michigan over 40 years ago, going on, I'm afraid, well over 40 years. I was very much an advocate for private medicine, the ability to provide healthcare. We were the patient's champions, but now things have changed. It's become very corporate, and it's very difficult to provide that care when there's so many those of us who in our country who could not have access to the best of the care. So there has to be changes, and the changes are not easy. As I said, transition is always difficult, but I think this is where autonomous vehicles and medical autonomy will actually be able to lower the cost and provide a better healthcare for most of us, and a more even state where the small rural community will get as good a care as in the big city.
So that raises the question, is autonomy the solution? I ask you that, and I'm going to give some economics for a background on delivering and providing healthcare. In 2022, healthcare expenditure grew 4.1% to $4.5 trillion. And this is in the United States. Let's break that down per citizen. $13,493 per person, accounting for 17.3% of the gross domestic product, as you said. $13,493 per person. Some starting jobs, they're only making $30,000, $38,000. You factor in the cost of living, the cost of housing. How is this sustainable? Is autonomy the only way forward?
No, it's part of the solution, but you're right. As I said, I don't think it's sustainable. And I'm not going to get into the politics. Is healthcare a right? Living healthy is a goal for all of us, but we need to find a way that we could provide the best basic healthcare for all of our citizens without bankrupting them or the country. And that becomes a problem. And then you might go further to talk about, well, where do we cut the cost and how do we provide that basic cost? And that's the problem. And that's going to be a societal answer, not something that's going to come from doctors or lawyers. It's got to be coming from us as a nation figuring out what we want to do. And it's going to be some hard decisions.
Okay. I agree with that. Here's the question. Are the health insurance companies too big?
Health insurance companies are there's something that you want and you don't want at the same time. So it's sort of a love-hate relationship. If we're perfectly healthy, our health insurance companies are wonderful because we don't need them. And if you're very, very ill, it's wonderful if you have health insurance because they provide all that life-saving care. It's that in between where we really get taken for a ride. And you have to look at other healthcare systems, and everyone talks about how the Canadian system is such a wonderful system, but that's really a bankrupt system where you have to wait 6 months a year to see a specialist. Hip replacements, a year wait. If you're over a certain age, you don't get particular healthcare from a heart transplant in the elderly, because what are the return of investment for the country? So it's a very, very dangerous direction to go when you go down that slope. So insurance companies as a whole provide a service, but the problem is when you take a look at the difference between healthcare, something like Medicare, which has a very low profit margin, and they provide very basic healthcare. It is not an easy system, but it does provide care, as opposed to a private insurance, whether it's Anthem Blue Cross, Blue Shield, United Healthcare, Aetna. Their goal is profit. And while I understand in a capitalist society that profit is important, but the difficulty for patients and physicians to work through a private health insurance is difficult. And the same thing can be said for Kaiser, which is an HMO, a health maintenance organization, where you have to jump through hoops to be able to get the healthcare you think. So it's really a difference between expectations and delivery. And I think patients as a whole, as a nation, we have too high of an expectation, and the delivery on the healthcare insurance are too low.
Yes, that's well said. So let me ask you a scenario. It's illegal. I'll start it with that, but it's an interesting scenario, and I've done some economic modeling around it. What if we allowed catastrophic insurance, and then you can go to a doctor and pay all cash? Would that change the system, or would the health insurance companies just come out, oh, you can't do that?
Yeah, that was part of the Obamacare. I was not a big fan of Obamacare when it came out, and I still am not a big fan of it. The problem is because insurance companies still had a lot of say. So really, what happens is roughly 80% of our healthcare expenditures are in the last 2 years of your life. So it's really the elderly that really use the cost. It's not the 30-year-old or 40-year-old. So, but a 30-year-old or a 40-year-old to get health insurance has to pay the full package. So you have to get the full Monty, where they really should have the ability to just get catastrophic insurance. What that means is that if, God forbid, you're in a car accident and you need surgery, it's covered. If you have appendicitis and you need an appendectomy, you get insurance. But if you twist your ankle, you just go to an urgent care and you pay out of pocket. So people would save a lot of money by just being able to get catastrophic insurance. There is one policy that's out there, I think if you're under 30 that you could have, but it's almost a useless policy, in my opinion. So I think having the ability to have catastrophic insurance, if you choose to do so, would be a wonderful way of trying to lower that person's costs. But the problem is insurance companies are going to say, well, if you do that, we're going to increase the premiums that we're charging to everyone else, which means those of us who are older, like myself, and other people who are ill who need the insurance. So therein lies part of the problem.
It just seems like a giant Ponzi scheme. So let's ask this. So, and I'm going to add some numbers to this because I'm thinking a lot about this. So you mentioned later in life, and let's add some economic numbers to it. On average, this is in the United States, the cost to provide healthcare for the last year of your life is $80,000 per individual. 66% of the cost is paid by Medicare. Thank you to our taxes. In 2022, Medicare spending grew 5.9% to $944.3 billion, which was 21% of the total U.S. healthcare expenditures. In 2022, 3,273,705 million individuals died in the United States, accounting for roughly $2.61 billion in healthcare spending. So if it cost you $80,000 the last year of your life to die, what if every week you put $10 aside into the S&P 500 and let it compound? That's an insurance policy that it can cover your death, and then guess what? Your kids can have something left over. When do we get thinking like that?
There actually was some policy planning along those lines about 15 years ago when I was involved basically on a national level. I think it was Senator McCain's 2008 presidential campaign, where there was some thought that you could have basically a private health fund to do just that. And then there was pushback saying that people basically aren't smart enough to invest their own money for their health care. And it never went anywhere. But there is a thought. So there's been also some thought of just taking, instead of having a multiple health insurance, that you put a certain percentage of whatever is brought in as a health insurance fund that goes for the nation. And health insurance is just then paid through that fund. There's ways to pay for it, but the problem is now with runaway healthcare costs from insurance companies, it makes it very difficult to rein in that cost. You also have to take a look at what the expectations, like I said earlier, certain patients have expectation of having end-of-life care that goes beyond measure. So an 85-year-old man or woman who needs a heart transplant, is that take priority over a 25-year-old who needs a heart transplant? These are not questions I'm going to answer, but these are questions we as a society have to decide. So it's the last 2 years that really are the major healthcare costs, and we have to decide how far does one go and to what extent does one go and what's the quality of life. So there are a lot of questions that you bring up, and we don't like to look at healthcare as a financial cost, but it is a true expenditure. If you look at 70% of the GDP, let's say you cut that down to 5%. So that 12% differential, what can you do with that money? What's 12% of our GDP? I can't count that high. So there's a lot. You talk about then taking care of the homeless, the underprivileged. There's a lot that we can do. We need to bring the cost down. There's just no question.
Could we take that cost savings and invest it in preventative medicine? And I'm going to pull a Benjamin Button on you and go backwards here. We're going to go from death to senior citizens, 65 and older, because personal health care spending for the 65 and older population was $22,356 in 2020, over 5 times higher than spending per a child, which is $4,217, and almost 2.5 times the spending per working age person of $9,154. Raises the question, could preventative medicine, preventative techniques help to lower these costs long term?
Well, now you're narrowing it down. And I'll tell you where I'm going to give the punchline, what I think is a solution, but I'm going to answer your preventative medicine. I think the punchline, or not punchline, the ultimate solution is going to be what I call interactive medical autonomy. So you talk about autonomous vehicles and you talk about AI. So the real solution is going to be this interactive medical AI or autonomy. But as far as prevention, if you take a look at, we did a paper review many years ago now, looking at what preventative medicine does. So preventative medicine, while it's wonderful and good, it means eat healthy, exercise, make sure you take your multivitamins, all these things. How much does it really extend your life? There are some studies will show that about 8 or 9 years you could extend to the max, which is wonderful. But again, it does not extend the last 2 years of your life. So if that's where the costs are, even if you have preventative care, you'll live, let's say, 8 or 9 years longer. You still are going to have the last 2 years of your life, unless you get hit by a truck, which would be driven by a person, not autonomous. But so those are things that you have to look at. And prevention, by the way, it should not be we rely too much on the physician and the healthcare provider for prevention. You don't need a doctor or a nurse to tell you to eat healthy, to exercise, to take care of yourself. That's something that should be intuitive and should be very simple to provide. It shouldn't take a healthcare system to do that.
What sort of incentives can private businesses do to help encourage this? Because they account for 18% of the total healthcare spending.
So we have an unusual healthcare system in our country. The vast majority of our health insurance is provided through our jobs. So that's good and bad. So we like to have job security and jobs providing healthcare, but it also makes it very dependent on what insurance that particular job offers and depending on the cost. So the jobs will then determine, or the employer will then determine what insurance policy they buy you. And I'm afraid most employers will buy the cheapest policy possible without the best benefit. So you've got to take a look at what the insurance provides, what the economic incentives are for the jobs to continue on a good policy. If you think about the long term, the smart companies recognize that the employee who is sick is not producing. And when you're not producing, you're losing money. So that's going to be the main goal. And the smart ones recognize it, but not all of them do.
Okay, so let's play a hypothetical here. Let's just say, right, the private businesses said, the hell with your health insurance. We're going to self-insure. Screw you. We're going to self-insure. And they took away, this is crazy, private health insurance spending $1.2 trillion in 2022, or 29% of the total U.S. healthcare expenditure. Let's say private businesses took away that $1.2 trillion, invested in their employees, self-insured. What happens to the market?
That's a brilliant. I'm not the economist. I actually I've heard of a number of companies that do self-insure, and they're very satisfied with that policy. But the problem when you self-insure, you're only as good as the cost of that policy that you're self-insuring is within the realms of the companies being able to provide that care. So what happens to the company if they don't meet their benchmarks and they're trying to maintain that insurance? How are they going to be able to adjust that? So the problem is leaving healthcare to the free market can be good, but there's so many regulations that to self-insure that makes it somewhat difficult to do that. When you go through the public insurance companies, you have to rely what they provide, and every year they've been going up. So it's not something that's stagnant, even though the cost of medicine may or may not go up. And then you go through what services are provided. Every person who has health insurance wants everything provided, from IVF, in vitro fertilization, to non-urgent or life-threatening care. Should that be covered, or should it not be covered? That becomes a problem as well. So again, this is what every person, including myself, I want everything and I want it now. And when you're looking at those who are paying for that, are saying, look, we will provide the basic insurance for you, but we're not going to pay for more. And that's where I said patients have greater expectations of what they deserve or want. And insurance companies have greater desire not to provide that service because there's more money in their pocket.
Yeah, no, there's a lot of points there. So let's say banks, the Basel III requirements are required to have a certain amount of cash reserves on hand all the time. Let's just say you start with a company with, I don't know, say you're doing $1 billion a year in revenue. What if it make them have a certain amount of reserves and they self-insure, and then they just reinvest that money in a money market fund? You're getting 5% now. They're going to outperform. They can give the Cadillac. I'm going to go back to the old days. They get the Cadillac plan without having to get denied at the insurer. That becomes a way to get the employees back to the office. What do you think about something like that?
It's an interesting idea, but I don't know the specifics enough about a lot of these self-insured companies. So even if you self-insured, you still have to go through some entity which is providing that care. So it's I think Kaiser Foundation started as self-insurance from the Kaiser Steel, I think it was, way back when. And for those of you who don't know, Kaiser is an HMO insurance that is provided out in California mostly and the West Coast, but it's an HMO. So that, I think, started out that way, but then there are some limitations within that policy as well. So I just don't know what the simple answer. In a perfect world, yes, Grayson, that would work. But what if you said that company has to maintain, like you said, $500 million in an escrow account that maintains it, and they put that money in a mutual fund. In a bad year, if the market crashes and then the insurance premiums go up 20%. So there's still some risk. So you're risking as well. So again, I don't have a full answer, but it's an interesting idea.
There's risk, and there's risk the insurance company's not paying it. And then you get in a vehicle, and every day that there's risk, because motor vehicle crashes are one of the leading causes of death in the United States. With over 100 people a day die in a motor vehicle crash. In 2015, more than 2.5 million drivers and passengers were treated in emergency rooms as a result of being injured in motor vehicle traffic crashes. The economic impact of crashes is notable. For crashes that occurred in 2017, the cost of medical care and productivity loss associated with occupant injuries and deaths for motor vehicle traffic crashes exceeded $75 billion. In 1 year, $75 billion in economic harm. If autonomous vehicles are able to eliminate a majority of crashes, the economic impact could be astronomically positive. What are your thoughts, and what impact will that have on the delivery of healthcare?
Well, now we're getting to the solution, which I find exciting. So we talked about all the problems at healthcare, and it's been a long time coming. And one of the things I find about innovation is usually innovation finds the solution. And I think that's where we're talking about, from medical autonomy to AI to interactive autonomous intelligence. So it's over 30,000 deaths a year, but that's not including those who are injured. So God forbid, if you die in a car accident, the cost is really zero because you're not being taken care of. So you're talking about those who have been seriously injured in the cost. So the autonomous vehicles, autonomy, should reduce the number of motor vehicle accidents, deaths, and injury by an astronomical number. I think the number is over 90%. You would know exactly what that is. I don't know specifics, but you would save, like you said, a tremendous amount, billions of dollars in costs that could be provided for underserved communities that need treatment for asthma, for all these other things that can be done. There's a greater utilization of that money that could be provided for care. So I think autonomous vehicles are going to be they'll be a leader in the reduction in healthcare costs, specifically from motor vehicle accidents. And there's a number of pedestrian accidents. People don't realize that cars hitting pedestrians. I mean, these are tremendous. Vast number of vehicle accidents are from DUIs, driving under influence, whether of drugs or narcotics. So there's a tremendous benefits, but that's not the only benefits of autonomous trucking. Yeah. Where you take a look at, and people don't realize that that's a vital industry that we require. The ability for the transportation to be not just 8 hours in a 24-hour period, it could be 24/7. So there's ways that the autonomous industry can, I think, be a lot more productive in saving healthcare costs.
It could save healthcare costs, and today is a sad day. Today's the day the music died, and I was reading about the Big Bopper and Buddy Holly, and there was a gentleman went on to become very famous, went on the bus, was Waylon Jennings, who was a bassist in the band. And Buddy Holly said to Waylon Jennings, "Hope you freeze to death on the bus," because the drummer got frostbite on his toes and they had to pull the drummer out. And Waylon said, I hope you die in a crash. And he said it was the thing that haunts him to this day. Wow. So that's a very well-known situation that the day that the music died. So there's a lot of negative societal impacts from car crashes and plane crashes, a lot of very negative economic consequences on that as well. So as we fast forward into the future, when do we get to the point where insurers look to bundle healthcare insurance with autonomous vehicle liability policies? Because to me, it seems like there is a potential overlap there, and it could be a way to save money, because if you're saving $75 billion roughly a year from car crashes, it seems like there's a ability to bundle something and spread out the risk.
Well, I'm going to throw one back at you. I'm going to take over the show. What happens to these insurance companies that have been getting billions of dollars a year from auto insurance, that now that I pay and everyone pays for auto insurance? So if you have autonomous vehicles, I don't need auto insurance. What happens to their business model? Where do they find that other revenue? So that's really becomes another question. Are insurance companies going to be autonomous friendly or not? And that's one that I don't know. But think about the billions of dollars that are spent on auto insurance. So the it's sort of like the insurance industry is a paradox that they're there for you, but they don't want to pay for you if they don't have to. Yeah. So it's a complex problem.
The Jake from State Farms don't like this industry, but you look at the Munich Re's, the Swiss Re's, the various large reinsurers, they like this industry because it is a growth market for them.
So it's going to be a transition, just like the tobacco industry moved on to selling everything else.
Yeah, exactly, and it'll lower the risk and eventually increase their profits. I think it's going to be very healthy for the insurance company, because you're not going to have an individual who's distracted driving.
Right. So I think the direction that we're going as we're sort of progressing along this path is showing not just, everyone thinks autonomy is just a driverless car, but I look at it as an entrepreneur that this really is an innovation. It's a paradigm shift going to artificial intelligence. Mm-hmm. And that's where we're going. So what does artificial intelligence really bring us? And I think it brings us a lot more solutions than problems, even though there are always problems, like I said, in every transition. But I think we're eventually going to get to the point where there's so much more on the healthcare side from AI, that's whether it's from autonomous vehicles, transportation, the ability to transport a medication from a high-level facility to a smaller town through a drone. That's artificial intelligence, and that's autonomous. So I can get that from point A to point B very quickly. So there's a lot of innovation that's coming with AI that's going to help save lives.
Where does Neuralink fit in this?
Oh, God, Neuralink. So Neuralink is a fascinating company. And, whatever you say about Elon Musk, he is innovative. And by the way, Neuralink is really the ability where they're going to put a small chip in the back of the brain and use telepathy to be able to communicate with the computer. So they're looking now to get, I think, 5 or 6 quadriplegic patients. They put a little chip. It's a tiny little chip. It's about the size of a quarter, and they have little fibers at the end that will go into the brain. And then through thought process, the patient will be able to move a computer cursor, will be able to move a robotic arm. Now, there are other companies that have done this before him. So not to take anything away from Elon Musk, there's a company called Synchronon, which they are doing the same type of thing. Precision Neurosciences, they have 6 test patients where they use a fiber which is about a fifth the thickness of a hair follicle. And then there's another company, I think BlackRock Neurotech. It's a little bit older company. They've already safely implanted chips in patients, in quadriplegics, and they're able to operate robotic arms. So these are all phenomenal technologies. So if you think about where the future goes, this is what's going to be life-saving. They have other type of technologies where they have, you may have heard of exoskeletons. Mm-hmm. So now the big thing is they use these exoskeletons to help workers be more productive, but it really can be used those who have what we call hemiparesis or quadriparesis, where it's really not completely paralyzed, but you have some weakness, but you can't stand. So with these exoskeletons, a person will be able to walk again. It's mind-boggling. There's also optic nerve chips that where I always joke that Star Trek was always ahead of all medical technologies, even from the original Star Trek with William Shatner and Leonard Nimoy. So there is one of the Star Trek series, I think, Next Generation, where this character Geordi wears these glasses and he can see, but they actually have these glasses now that you could put in and it clips into the back of the head with a neurochip where it gives sound wave. So while it's not vision, but a blind person then can get 3D depth perception if there's an object in front of them, if they're not. So this is where innovation comes. It's artificial intelligence. You have insulin pumps. You have atrial fibrillation devices. You have devices where whether it infuses medications or can follow cardiac arrhythmia. So these are all things that are in the future, and they're exciting. So that was a long-winded answer for Neuralink, and I think this is where I say technology and innovation will end up saving the day. I really do believe the greater good will come from this. There's always risks. There's always fears. There's study. They have these robots in nursing homes where they actually have a smiley face on them, and they will go up to patients in their little sitting area and they will talk to the patient, and they're interactive. And they've got studies to show that patients feel much better about their quality of life. They now have these interactive robots where they can do the 3D image of a real person. So, there's a lot of things that are there. I don't want to go into the things some of the Russians are dealing with on some of the robots, but they make them very human-like.
Yeah, interactive autonomy is great because it all goes back to the experience. When you ride in an autonomous vehicle, it's an experience. You're getting care delivered autonomously. It is an experience. In your opinion, what is the future of medicine?
In a nutshell, I think it's very promising. It's also scary. So there's a difference between the future of medicine and the future of healthcare. And that's what we have to come to grips with. So the future of medicine is promising. If you look what we do in our lifetime to what my parents did in their lifetime, and then what you look in my kids' or my grandkids' time, it's going to be an astronomical paradigm shift in the quality of life. For those who have been unfortunately injured with being a paraplegic, quadriplegic, the ability to move again, the ability there are these prosthetic arms now where they attach an electrode to some of the muscles in the hand. If they say, God forbid, you lost your hand, and then they put in a chip in the back of your brain where you can communicate with artificial limb to close and open. You have the ability now with sensors that you could feel warmth or cold. You have the ability with these artificial limbs to pick up an egg without crushing it. It's today. It's happening now. It's not science fiction. It's science fact. So I think medicine, we will provide, I say we like I've done anything, but medicine will provide the solutions. The delivery of that care to the patient is not up to the physician or the nurse. It's up to society. And we have to decide how that's going to be. It's not an easy decision. So it's got to become common ground, common solutions. Not everyone's going to be happy. I had a lawyer once, so I asked, why is, he told me that the law isn't meant to be fair. It's meant to work. So while healthcare, I would like to think would be fair, it's not. Though those who are born with a congenital anomaly, it's not fair. Those who are quadriplegic from a car accident, it's not fair. But we need to find a way for it to work for the vast majority of those who really just want what's best for everyone else.
Society's going to have a lot of big questions to ask, and we're going to have you back as we expand the road to autonomy economy. As healthcare being 17% of GDP, there's a lot to tackle. This was a really great intro for today. And Peter, as we look to wrap up this insightful conversation, what would you like our listeners to take away with them today?
I think that's a great question. And I think simply don't be afraid of the future. Don't be afraid of autonomous vehicles. Don't be afraid of artificial intelligence. It's okay to be concerned and worried how we handle the transition, but the transition is going to be there. It's going to be difficult, but at the end of the day, it's going to help our lives be better.
I like that. Don't be afraid of the future. Lean into the future, because the future is bright. The future is autonomous. The future is delivering healthcare in an economically possible manner. Dr. Weiss, thank you so much for coming on the Road to Autonomy Economy Edition.
Thank you.
If you've enjoyed listening, please kindly rate, review, and subscribe on your favorite podcast platform. Want to get in touch? Follow us on Twitter, Instagram, and YouTube at Road to Autonomy, or email podcast@roadtoautonomy.com. The Road to Autonomy podcast is produced by the Road to Autonomy LLC. The views and opinions expressed in the Road to Autonomy podcast do not necessarily reflect those views of the Road to Autonomy, its subsidiaries, its shareholders, directors, investors, or partners. The content discussed on this podcast is for informational purposes only and should not be taken as legal, investment, tax, or business advice. Nothing is a recommendation that you purchase, sell, or hold any security or other investment, or that you pursue any investment style or strategy. The content of this podcast is presented on an as-is basis with no warranties, express or implied, of any kind. Financial mentions about companies in the Road to Autonomy Index and discussions about the Road to Autonomy Indexes are for informational purposes only and should not be relied upon when making any investment decision. Furthermore, an inclusion of security within the Road to Autonomy Index is not a recommendation by the Road to Autonomy Indices LLC to buy, sell, or hold that such security, nor is it considered to be investment advice.